She was nearly bleeding to death because of a botched, illegal, back alley abortion. And she chose to put herself through that danger because she knew that she was no way ready to become a mother. And sadly, she's one of thousands of stories of morbidity and death each year before Roe v. Wade became the law of the land. And it's a reminder that making abortion illegal or hard to access won't stop abortions, just safe abortions. I guess I should introduce myself. Hello, everyone. I'm Lois Frankel, your member of Congress. It's so great to see this intergenerational crowd and all the male feminists. Thank you for being here. I love the signs. Keep your bands off our body. That's a good one. I can't say all of them. Some are X-rated, but I do enjoy them. You know what? There are millions of us around the nation now, 600 rallies, and we're standing up for reproductive freedom and choice and justice. And let's say it, our bodies are freedom. Listen, I'm not really here today as your member of Congress, but in my most favorite role, that is mother and grandmother. And because, like many of you, I know the joys and the responsibilities of raising a child, and now the absolute pleasure of having a grandchildren who I get to spoil and send home. You know what that's like. Look, here's the thing. Whether or when or how to become a parent is the most important life decision we make. And every person, regardless of their zip code or income, should have the freedom to make their own decisions about their health and bodies, including abortion, right? And not controlled by politicians, neighbors, complete strangers, or anybody else. It is our bodies, right? I'm going to read a sign. What is a good sign out there? Let's see. We're not overreacting. I like that one. My choice. Pro-choice. Hey, listen, you know what? The Texas law is shocking for so many reasons. It deputizes citizen vigilantes. What I gotta say that word?
Vigilantes.
Vigilantes. Thank you. Vigilantes to go after abortion providers. It bans abortions before most women even know they're pregnant, and more. And the Supreme Court didn't even take the time to have a discussion. But let me just tell you. Let me just tell you something. That law is not an aberration. Since Roe v. Wade became the law of the land, there's been over 1,300 laws passed across this nation to either block or ban abortion. And what this means, that in most counties, 90% of the counties in this country, there are no abortion clinics. So, and what crazy restrictions. And not only the mandatory waiting times and the ultrasounds, but even requiring doors at clinics to be a certain width. Right, you have to have a certain width of a door. So, look, we're here to say what? Our bodies, right? Our choice. And let me just say, you know, the Texas law, which I know Senator Berman is going to talk about what's happening in Florida, because, you know, there are little copycats up there, our Republican legislature. I see there's someone who was assigned about I call him Ron Death Santis. Ron Death Santis. But I can't say that sign. But listen, there's even a greater worry now, because this Monday is the start of a new session of the United States Supreme Court, and it also may be the last term where Roe v. Wade is the law of the land, because they're going to hear a case from Mississippi, and it really is threatening our reproductive freedom. So we are here today. We are sending a clear message with our shirts and our signs, and because we are saying that reproductive freedom is not going to end on our watch. So make your voices loud. And make sure you make your votes count. And let me hear you say again, it's our bodies, our freedom. It's our bodies, it's our freedom. Our bodies, our freedom.
Our bodies, our freedom.
All right, thank you all.
To chip away at abortion access in all states, surprisingly, Florida will be next. The abortion plan clearly violates the constitutional right to abortion established by Roe v. Wade. These barriers to abortion are harmful and unnecessary. Monday, the United States Supreme Court will start a new session. They will be hearing a case to overturn Roe v. Wade. Well, we're here to tell them no. We're here to tell them hell no. 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 Nobody wants to have an abortion. It's the hardest decision a woman will have to make. But a person's decision to have an abortion is their body, their choice. 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 People of color, people who struggle financially, women that live in rural areas, our trans siblings, and the incarcerated will be the people most harmed by SB 8 and Florida HB 167 sitting in Tallahassee right now. It doesn't matter who you are, what your background is, or what your reason for having an abortion. You should be able to do it without interference and without shame. We stand here today as Black, brown, indigenous, Asian, Latina, white, queer, trans, and formerly incarcerated people defending the safe, accessible, and affordable health care. We stand here today because abortion is health care, and health care choices should never be made by politicians. We stand here to say, our bodies, our choice.
I had an abortion. There's no shame in that. But can I encourage anybody out there that has had an abortion? You say, I had an abortion. So what can we do? What can we do? I know we have to think about accessibility, affordability, and limiting the shame, right? No shame. So the first thing we all have to do is we have to tell our stories. But what's important is I have the ability to have a safe, legal abortion. But in many parts of the states, that's not true. You've got to help register people to vote, because that's the only way that we're going to be able to get the people that we need into the local legislature, into the federal legislature. Because we have a lot of people that cannot afford an abortion.
Reproductive freedom also includes creating conditions so people can choose when they have a child. It's dismantling sexist, capitalistic structures that keep people from having the resources to be a parent. Anti-choice lawmakers are trying to strip us from our bodily autonomy. I don't use the word pro-life, it's anti-choice. Pro-life would be voting for social safety nets, providing free education, raising the minimum wage, simplifying the adoption process, or enforcing mask mandates. The anti-choice movement aims to strip us of our bodily autonomy and chastise us for our choices. They are not pro-life. They are pro-fetus until the baby is born and comes out as trans, or marries a partner of the same sex, or is a person of color. So I ask you all, as we continue to fight for reproductive rights, ask yourself, is my work intersectional? Does it include the voices of marginalized community? Am I doing the work to create a welcoming environment for people of color? Am I uplifting people of color? Am I making space for them without putting the burden of inclusion on them? Is my organization taking into account the experiences of trans women? Are all marginalized communities being represented? Am I being intersectional?
I am a Cuban Chinese sex work activist. Every time we gather like this, it gives me hope in what can feel like an unhopeful dystopian world. We are often excluded or mistreated in activist spaces. Sex workers have historically been at the forefront of these movements. Sex work can be dangerous because of the many systems in place to criminalize bodily autonomy. We are often at risk to sexual assault, physical violence, and police brutality. Sex work is the most intersectional issue at hand, and yet we are always forgotten and ignored. Sex workers consist of a myriad of folks, the majority being queer, trans, black, indigenous, people of color. Sex workers often take several measures to ensure safety from this. However, Johns will often manipulate workers into unsafe sexual practices with the promise of more pay, such as not wearing a condom, putting the sex worker at risk for pregnancy and STI. I myself have been a victim of such a practice in order to feed my family. 65% of sex workers will become unintentionally pregnant and seek an abortion. When we talk about bodily autonomy, we cannot forget to be inclusive with our language. What we don't hear about are the unique socioeconomic struggles faced by queer and queer-gendered folks, especially queer people of color, many of whom will turn to sex work in order to help make ends meet or pay for medical bills. LGBTQIA people have a higher risk of sexual assault, intimate partner violence, stalking, homelessness, and healthcare discrimination. That makes them 2 to 10 times more likely to become unintentionally pregnant. NBC News shares a story of a non-binary trans man, Kazembe, who took out a loan of $300 to pay for his abortion. Kazembe got pregnant after they were sexually assaulted, and it took a year to pay off that loan. I myself, a non-binary femme, became unintentionally pregnant in 2016. And at the time, I was not out, and I didn't understand how much that abortion would save my life, how it would affirm my gender and grant me the autonomy I needed as a queer-gendered person. Pregnancy can add to the dysphoria that we queer-gendered people already live with. Abortion is gender-affirming. Abortion is a right. Abortion is healthcare. DeSantis has put scientists in jail. There have been 3.57 million cases of COVID. And why did he allow 54,000 deaths to occur? How can you be pro-life when you have so much blood on your hands? Meanwhile, his children will never have to worry about being exposed to COVID because they go to the best, most expensive schools, and they require masks. We cannot allow a murderer to become our next president. Governor Ron DeSantis does not care about black people. He made that clear by attempting to introduce the HB1 Anti-Riot Act. DeSantis does not care about lower income families because he has not extended the eviction moratorium, forcing folks to put themselves at risk of a deadly virus to feed their families. The people who don't want trans people to transition are the people who want to criminalize abortion and are the people who want to criminalize sex work. It's one fight. Every moment demands we fight for a future where reproductive health care is available, affordable, and accessible for anyone and everyone who needs it. Thank you. Our choice! Katy, our choice!
I'm going to be 84 years old. I've been a working registered nurse for 60 years and more. I've probably been many of your abortion nurses at the best abortion facility locally, where we work behind bulletproof glass, we survived arson, and we're still providing excellent care. In 1967, we finally got birth control that wasn't pull out, lock the bedroom door, use a condom, or whatever. But that birth control was only for married women who had a prescription that was signed by their husband. In other words, useless. In 1967, I was pregnant with a pregnancy that I couldn't afford emotionally or financially. I had 2 sons I was raising very well alone. And so my best friend in the world gave me an anonymous telephone number. I called that number. I'm sure they asked me when my last period was. I don't remember any of that. I remember that they told me to show up on a specific corner in Miami at a specific time on a specific day, and I would be picked up. So my friend dropped me off there. I didn't know Miami from Who Shot John. But they picked me up, they hid me under a rug so that I couldn't know the route we were taking. They drove me into a residential garage. They assisted me into the kitchen. They did my procedure on the kitchen table with no medication, but I will say with great care, and I was lucky. I had a doctor who performed my procedure. They didn't speak my language, but they spoke my language. They took care of me. I lost one of my hard contacts. They assisted me back to the car, covered me back up with the rug, and drove me back to my corner and dropped me off to be picked up. And the next day I went to work here as though nothing had happened. I don't want that for anyone else. My very first year out of nursing school, I worked in a college town in a very small hospital. Girls would come in hemorrhaging, infected, and septic. I wasn't working in the abortion movement then. I was just trying to become a nurse. But it gradually has led to that. And for the last 28 years, as I said, I'm sure I've been the nurse of many of you here. And my heart is with this project. The most important thing we have is our vote, and that too is as extremely at risk as our abortion rights. So you have friends that go home and watch TV, not the news, not anything else, but whatever the current show is, and go to bed and don't think any more about it. You have to rattle their cages and tell them that this is our life. We're losing our democracy as well as the control over our uteri.
Good afternoon. I'm Lori Berman, and I'm the state senator from District 31. Many of you throughout our country, I posted on social media for National Daughters Day and National Sons Day. Similar to you, I shared my pride and joy in my children's accomplishments and pronounced my love for them. Today we have another nationwide event, this rally, and the juxtaposition is clear. If we really support our children and families, we must give them autonomy to make choices about when to start a family. We must respect the choices that individuals make and ensure they're treated with dignity and justice. So to all those who flooded social media, now is the time to take action and show that not just words matter, but action does. I want you to understand what's happening in our state capitol, unfortunately. For 11 years, I've been a legislator, and I can tell you for almost every single year, there has been an anti-abortion bill passed. Boo is right. This has been a concerted effort to chip away at Roe v. Wade. And Congresswoman Frankel mentioned some of them, and I'm going to list a few more, and we can boo them all. Mandatory ultrasounds. 24-hour waiting periods. Unnecessary changes to parental notifications for minors. 24-week abortion ban. And restrictions on facilities that where abortions are conducted that are unlike any on any other medical facility. And yet, during that same time period, we've had very little done in the Florida legislature to improve sex education and access to contraception. We know that maternal health is not a priority of the legislature, and the only thing is chipping away at Roe v. Wade. So that gets us to this year. And this year, we already have a bill filed in the Florida legislature, exactly like the Texas law, which would prohibit all abortions at 6 weeks, no exceptions for rape and incest, and allow vigilantism also with rewards for those who report on their neighbors. So even if this bill doesn't move forward, we've heard from leadership that they intend to pass a bill that will limit Roe v. Wade. This is the culmination of their nefarious plan to stop women and families from having agency and autonomy over our lives and our bodies. But I know we have a secret weapon, and that weapon is all of us. I was in high school when Roe v. Wade became the law, and I do remember backroom abortions. But we have a whole generation, 2 generations, children and grandchildren, who rightfully so have known that they have the right to have access to a safe and legal abortion. They are not going to be put in a position where they have to worry about their friends being maimed or injured, or having to travel out of state, or for people who have money to be able to get that. So we need this whole generation. We need to wake up the sleeping giant and make sure that you get your voices heard. So one of the best things we can all do is vote. And there are people here today registering you to vote. Make sure you get all your friends and register and neighbors to vote. And what you need to do is vote out those people who don't support your views. Let's do it. Vote them out. Vote them out. Vote them out.
Vote them out. Vote them out. Vote them out. Vote them out. Vote them out.
Okay.
Vote them out.
All right. So when the bills come up in Tallahassee, we need your voices and your presence in the Capitol. Right now, you can start flooding leadership, because they're the ones who are going to set the agenda, with emails, phone calls, and any personal contacts that you can have. And then when the bills come to Tallahassee, I want to see all of you up there getting your voices heard. So I started this by telling you I wasn't elected to legislate your medical decisions, but I was elected to protect your rights to make your own medical decisions. I will fight with every fiber of my being to protect the right to abortion. Thank you all for being here and for joining me in that fight, and let's go do it.
First time as many groups have come together in Palm Beach County to work on one issue, because together we're better. I want to list the coalition that we've built by the groups that are here. We have Blast Women for Palm Beach County. We have Blue Wave Coalition, Palm Beach County. We have Compass, LGBTQ Community Center. We have the Democratic Club of West Palm Beach, the Democratic Club of North Palm Beach. They're both the women's club, I should mention. We have the Emergency Medical Assistant Group. We have the FAU National Organization of Women. These are women in their 20s, and they're joining the fight, and we are so excited. Palm Beach Indivisible. We have Palm Beach Human Rights Council. We have Planned Parenthood. We have the Presidential Women's Center. We have Ruthless, Palm Beach County. We have Sea Women's Organization. Unified Palm Beach County. We have the Women's Foundation of Florida, Women's March Palm Beach County, Workers and Families Democratic Alliance, and all of you here today. We stand together. Once again, women are called on to put our bodies where our beliefs are. We have been forced, even in a pandemic, to come out and fight for our right to choose what happens to our bodies. Senate Bill 8, Texas's 6-week abortion ban, is making abortion significantly more difficult to access for millions of Texans. This law is part of a larger trend from the anti-abortion advocates and politicians.
Hi, my name is Joy. I am
the president of the Florida Atlantic University chapter of the National Organization for Reproductive. So one of our core issues is reproductive rights. It's something that we have fought for years and continue to work towards today. When discussing reproductive rights, I feel like we all know the basics. Access to abortion, freedom to choose, etc. When we go out and lobby, petition, and advocate for reproductive rights, we must make sure that our work is truly intersectional. Intersectional feminism is a term coined by scholar Kimberly Crenshaw in 1989. Intersectional feminism looks at equality through the lenses of your various identities. It advocates for equality of all people, regardless of race, gender, ability, class, age, socioeconomic status, ability, or religion. It's equality for all. It understands that all oppression is connected and compounded. I can't one day choose to be black, the next day choose to be a woman. I'm both every single day. So when we fight for reproductive rights, we must fight for reproductive rights for black people, for members of the LGBTQ+ community, for indigenous people, for the unhoused community, for every marginalized community. Reproductive rights are an intersectional issue that affects people from all communities. This is not just a women's issue. This affects everyone of all genders. Womanhood is not defined by the ability to give birth or exclusive to cishet women. Reproductive rights is fighting for equal treatment and access for all. Reproductive rights includes abortion access, contraceptives, comprehensive and inclusive sex ed, assisted reproduction. It's not just about abortion. It's about giving people the bodily autonomy they deserve.
Hi everyone, I'm Carolina. I'm the Vice President of Generation Action at FAU. Nobody should have to fight for an abortion. As a representative of a student organization on campus, I feel that it is my responsibility to stress how serious this legislation is and how it's not a new development. Our bodies have been a battle zone since the moment we were born. As people with uteruses, we are constantly under fire for merely existing. This legislation isn't the answer. The only thing it will do is make abortion harder, and just because it's harder does not mean it's going to end. How on earth can you say that you even support life? To make someone relive that trauma again and again just so you can get the slight satisfaction of playing God? You're so busy worrying about the US going to war, we've hardly paid attention to the war on uterus. It's been happening for 200 years and quite frankly, I'm exhausted. And I can't imagine how the future generation will feel if we don't make the change now.
Transgender men! Intersex folks! Queer identifying people! Two-spirit people of the First Nations! And yes, our cisgender heterosexual women, we can all get pregnant and have children. A person's legal right to access reproductive health care services in birth control and abortion affects us all. Reproductive justice is the very framework that centers the global human right to have children, not have children, and parent the children we do have in safe and healthy environments. And this is the part where I recognize all of the men who showed up for us here today. I guess I don't have to tell you that you are the other half of this equation, right? To that end, reproductive justice should strive for everyone to experience the human right to bodily autonomy free from any form of oppression. Other states, including ours, are following suit. From Texas, somebody had a sign that said, "Houston, we have a problem." Our vision for equitable reproductive justice has always stood at the intersection of gender and sexuality and has never been more clear. The countless attacks on the ability to access abortion care across the United States has left people of color, young people, people with low incomes, people in rural communities, people of varying immigration status, with fewer and fewer options to receive the care that we all deserve.
I'm Jazz. I'm here representing Dignity Power on behalf of our leader, Trey Johns. She's also the president of Women's March West Palm Beach. So shout out to Trey. This is Jubilee, my niece. Auntie never stops. So I'm here today to speak to you all about what we do within Dignity, but first I want to give you all a couple examples of how this really hits home for me. In January 2020, just before the pandemic hit, I, myself, a lot of my sisters and the other folks with us in our org, we went to Tallahassee, we lobbied, we unanimously passed a bill called the Tammy Jackson Act. right? To end solitary confinement for pregnant women who are incarcerated. Then in May of this year, 2021, I was in Alachua County, in Gainesville, and we bailed out 3 women with the mom bailout program that we have. We did wraparound service care. We did all these great things. We don't just bail them out, put them out on the street. We take care of them and their children. We help them. We help them find jobs. We get them connected to sources that they need. But unfortunately, not even a full 2 months later, in July of 2021, Erica Heaven Thompson was arrested on an 8-month probation violation. An 8-month ticket, yeah, there we go, that went out on her. And she was 8 months pregnant. She delivered her baby in prison ahead of term. This was her 3rd child, so she knew she was in labor. She was in solitary confinement. Unfortunately, her baby Ava passed away. Why do I march? We say we need young people. I'm 31. I've been doing this work. I left teaching so I could come out and do this for my community. Why am I doing this if someone else's baby died? I get to work and bring my niece to work. I get to make my own decisions about my body. I'm asking today that you support Dignity Power because we've been out here doing the work. When this happened to Erica, she didn't call any other org. She called us on the ground because she knew we would be there to help. She held her baby for 4 hours before she was finally transported to UF Shands Medical Center, where her baby later passed away. The child's father, the other siblings, no one got to meet Ava. Now Senator Chevron Jones has introduced our bill. We've renamed it Ava's Law. We want to fully make sure that no more babies are born in prison. Single-issue feminism is a danger to reproductive liberation. I'll say that again. Single-issue feminism is a danger to reproductive liberation. We demand access to respectful and affordable quality reproductive health care and abortion. If you want to help Dignity, our Cash App number is hashtag or the $, Dignity Power. Thank you so much, everyone.
As a counselor who works with patients every day, I witness firsthand the desperate measures that people will go to when they need an abortion. The most restrictive abortion measure in the country went into effect last month, September 1st, and the law allows private citizens to enforce the ban, a vigilante system that enables individuals to report people to authorities for helping women who have abortions. This law gives private citizens the right to be bounty hunters. We know that the Florida legislature is chomping at the bit to do the same thing here. While we struggle to help the women of Texas with our resources, many will be left behind. Reproductive health care is a basic human rights issue. Laws that ban abortion lead to people dying, plain and simple. Floridians want abortion to be safe and legal. Your vote matters, and elections have consequences. I am pro-choice, and I vote.
If we give up hope, they win. So come away from here with hope, and my friend Genee Tinsley from For Freedoms for Fighters is going to give us some actions to follow up on, and I personally want to thank everyone for coming. Here, my friend.
Good afternoon, everyone. Thank you all for being here. It turns out to be a very beautiful event. My name is Genee Tinsley. I'm a licensed mental health clinician. I'm also founder of Freedom Fighters for Justice. Our group formed last year in wake of the George Floyd murder. We have come together with several groups and coalitions right here in Palm Beach County to help just fight against systematic oppression. So again, thank you all for being here and joining us with this fight. I was asked, how does Freedom Fighters mission statement aligns with Reproductive Justice Rally mission? It aligns because we are fighting for Black lives and persons of color lives. We're also fighting for women rights laws. I'm also a minority, and I'm also a woman. So I'm here today joining this fight with all of you here today. Again, we held many protests, rallies, and created platforms for organizations to join together to fight against racism. We all know that this is a medical issue. Also, we know that there is a disparity of medical issues amongst these particular ethnicity groups. This is, again, a healthcare issue that would target those lives to include low-income families, vulnerable persons, and LGBTQ communities. And again, freedom fighters, join this fight with all of you here today. We must work together to protect access to the full range of essential reproductive health care services for all women, all uteruses. We must mobilize as a community and send messages back to the Florida legislators who have blatant disregard on our right to choose for our own bodies. Other states have notions to introduce similar anti-abortion bills as well. We must be solid and a unified force. We must continue having awareness, rallies, banding together, and forming larger coalitions across the state of Florida. We are powerful in unity, and in unity our voices will be heard. How do we start this? How do we galvanize and collect ourselves? We start now, opposing this Florida Heartbreak Act bill, also known as House Bill 167, with local legislations. We write letters, we send emails, we make phone calls, we harass them. We join forces like we're here doing today, with a network of women of all colors, all ages, and all races. Again, thank you all for being here and making this such a success. We continue opposing this bill. Again, we have rallies, we write editorials to our local papers regarding this issue at hand, and call out legislators who dare to make decisions which affects a woman's body. Let's hold them all accountable. We use our platforms to amplify the voices that feel that their voices cannot be heard. Last, we vote out the bad politicians. We must vote, and we must vote again. Thank you all for sharing your beautiful stories today. Thank you all for coming together again and uplifting one another and supporting one another. This is what it takes, us banding together and coming together, all as a unified front. Thank you all again for being here.
Thank you.